Hi, my name is Darren, and I will be doing my presentation over malaria. So, malaria is a serious life-threatening disease. It's spread by the bite of a female Anopheles mosquito. It's caused by the Plasmodium parasites, which are single-celled eukaryotes, and they infect the red blood cells and liver cells. The main species that causes malaria in humans are P. falciparum, P. vivax, P. ovale, and P. malariae. The disease spreads when a female mosquito carrying the parasite bites a person and transmits the infection through its saliva. It can also be spread from infected human to a mosquito as well. And then the main virulence factor of P. falciparum is a protein called PFEMP1, which basically helps the parasite avoid the human's immune response. And if this is left untreated, it can cause complications like anemia, kidney failure, and pulmonary edema. So pathophysiology, once inside the body, the Plasmodium sporozoites travel to the liver cells. The sporozoites multiply and form merozoites, which are then released into the bloodstream. The merozoites invade red blood cells, multiply, and then cause the red blood cells to burst, which leads to various amount of symptoms like fever and chills. In P. falciparum, which is the most dangerous type of Plasmodium, they can release up to 40,000 merozoites per red blood cell, leading to organ failure and cerebral malaria. So the populations that are at risk are usually tropical and subtropical regions. It's most common in sub-Saharan Africa, South and Southeast Asia, and some parts of Latin America. About 95% of malaria-related deaths happen in sub-Saharan Africa, where P. falciparum is most prevalent. Poor populations are at a greater risk due to weaker housing, lack of access to treatment, and malnutrition. So treatment for malaria starts with confirming diagnosis with parasite-based testing, and then treatment is determined by a few factors, including the type of parasite, resistance, age, and pregnancy. Region also has a lot to do with what treatment is given. The preferred treatment is ACTs, or artemisinin-based combination therapies, which kill the parasite quickly and reduces transmission. Chloroquine is also used for non-falciparum species, which basically where the resistance isn't as big of an issue. On the pharmacological side of things, the drug artemether-lumefantrine is used. The artemether is the fast-acting part that kills blood stage parasites. Lumefantrine is the longer-acting drug that prevents relapse of the disease. Dosage is about the same for children and adults 77 pounds and over. It's 20 milligrams of artemether to 120 milligrams of lumefantrine. And it's recommended to take twice daily for 3 days, although this can vary depending on region. And then it's recommended to take with food or milk for better absorption into the body. And then disease prevention. Vector control is the most effective prevention strategy, which includes insecticide-treated bed nets and indoor spraying. People can also reduce risk by wearing long-sleeve clothing, using DEET containing repellent, and taking preventative medications when traveling to endemic regions.